Hello, hello. We are going live today. And today I am going to cover part two of C-section recovery. Okay, so yesterday we talked about the importance of recovery from a C-section and really why you need to heal your C-section scar, and not just your C-section scar, but your entire core. So including your pelvic floor after a C-section. And so, thank you for being here with me today, and I'm excited to be able to share some information. So, this is going to be very applicable to anyone who's had a C section, whether that is 1 week to 6 months to 5 years to 10 years, 15 years. This is all really good stuff and stuff that you should be doing after this massive abdominal surgery, which is a C section. So, a lot of times we're not giving guidance on how to heal after this type of surgery. And so I'm excited to bring this to the forefront. Now, if you missed yesterday's episode, I highly recommend you starting there with part one, just so you get a basis of the importance of starting this healing journey. Because when we don't heal our C-section scars, what I talked about yesterday was really the impacts that we see from that at that 10 to 15 year mark, and the patterns that we see in women's bodies after a cesarean birth that can be prevented from going down that journey. So the importance of healing a C-section scar, the reasons why to do it, we talked about all that yesterday. Today, I'm going to give you some more practical guidelines of how to actually heal that scar. And so thank you for being here with me. I'm talking to two different cameras, so you're going to see my eyes go like back and forth, and I'm sorry about that today. But I'm at home because the Wi-Fi, the office Wi-Fi is out. So I'm shooting live from home today. So thank you for being with me. Here we go, talking C-section recovery. And so this is the physical recovery of a C-section. There's obviously many, many mental components of recovery from birth, whether that was a vaginal birth or a cesarean birth. And so for that reason, I want you to know that that matters too. And you can definitely, seek help for that. But a lot of times starting this physical journey of healing your cesarean birth scars or any birth scars at all helps it helps to start to process the whole situation itself and kind of some of the trauma that might have come along with your birth story. And so for that, thanks for being here and starting this journey with us. All right, so you've had a C-section scar, and the very first thing you should do is a few things. Number one, obviously we want that scar to heal and close. Okay, so if you're only like a couple days out from that surgery, everything has to heal. And so I'm going to talk about it from the point at which the scar is healed. Okay, so if this is 6 weeks for you or 8 weeks, the stuff I'm giving you is going to be applicable to that. Now, you always want to check with your doctor first, because that is the most essential thing that you do, and work with a pelvic expert physical therapist who can truly guide you on this journey of healing your scar, healing your entire body from the inside out. Okay, so super important that we're not just healing just the scar. So when you're cut open during a C-section, they cut through 7 layers, and they also cut through the uterus. When they stitch you back up, they stitch up all those layers, and you end up with many layers of scar tissue. And so we can't just treat the scar that we see on the skin. We have to treat the deeper layers as well. We have to treat the uterus as well, and any of the surrounding organs, because a lot of times with those scar tissues, they become frozen and don't move. Now, that freezing in our organs, I'll explain it as we call it visceral motility on a physical therapy forefront. But all it means is that your organs have to move in your body. So they ebb and flow, and they do this independent of every single breath you take. So organs have to just move naturally. That's how you have natural peristalsis. So that means that's how your poop moves through your body and then eventually comes out. And that's all good stuff and normal stuff that has to happen. But with any abdominal surgery, actually, not just a C-section, our organs can freeze, and that can be a problem for us. And so here, that's also what we do. We would really work on getting those organs moving again, so you can have normal visceral function, normal organ movement in your body. Why is that even important other than for like peeing and pooping reasons and having good bowel movements? It's important because anytime we contract our core, our organs have to smush together and then be able to expand when we relax our core. So these have to be dynamic organs and they have to be moving. And so postpartum, even if you had a vaginal delivery, this is stuff that you want to retrain. And this is stuff that we retrain in the clinic postpartum, is that organ movement. So we're not just walking around like contracting against really tight structures that have scar tissue and then aren't moving. Okay, so that's part of the C-section rehab as well. So when we're talking just C-section recovery, and I'm going to expand this to vaginal birth recovery too, because it's absolutely applicable. So whether you've had this vaginal delivery or C-section, it is actually applicable for both groups of people. We're going to start with breathing. All right, you've probably seen me do many videos on this, but one of the simplest things to do, and you can start this, and you should start this really day one, is training your diaphragm to go back down into your belly and take up the space where your baby was sitting, okay? Breathing postpartum, especially right away, is going to help that uterus contract back down into its normal size, and so it will help the healing process as well. Other things it's going to do is your ribs increase like this so that the angle increases during pregnancy, and we want to help try to bring them back together as we restore our core postpartum. And so in order to do that, really working on that diaphragmatic breath is going to help the flared ribs from pregnancy come back together. Okay, so one thing I love to do is stick a hand on a belly, stick a hand on chest, and just do some nice deep breathing here. If you're 1 day or under 6 weeks postpartum, all you do is stay in a pain-free range, stay in a comfortable and easy range. And that's really across the board, but you don't want to be stressing the tissues if they were just cut open today or yesterday or whatever that was for you. So we're going to take a hand on belly, hand on chest, and deep breath into belly. And let it go. Deep breath into belly. And let it go. That's phase number 1. Phase 2 is you can start playing with where your breath is going. So we're going to go hand on belly, pull the air down into the belly. And then we can go pull the air into the chest and actually expand our rib cage a little bit. So really bringing that diaphragm to its max stretch. All right. And then let it go. And so you can play with both types of breathing. And that's really, really good postpartum. And that's great post-cesarean, because what that's going to do is that's going to also stretch. It's going to start to move the scar and stretch the scar from the inside, not just the outside tissue. All right. So your breath is one way to really start stretching that scar. Now, if you're 6 months postpartum, 3 months postpartum, 5 years postpartum, you don't have limits on that type of breathing, right? You're going to breathe to really start working and stretching that scar. And so that's going to be really important for you to stretch that scar from the inside. All right. So breathing is number 1. All right. So we're talking C-section recovery. So number 2, and now this is also immediate C-section recovery to 10 years postpartum, because one thing that happens during pregnancy, independent of what type of birth you had, is that you lose your hip extension. What that means is our leg doesn't come behind our body with as much ease. I'm still working on this as I'm 6 months postpartum. And what happens if your leg, this isn't a great view, right? But if your leg isn't coming all the way behind your body, then you start to arch your back. So you start to arch your back to get your leg behind your body. Well, what happens with that is that can cause a lot of back pain, start to strain certain vertebrae and discs, and then that can also cause pain on anywhere in the back, truly, or it could be one-sided pain versus the other. All right, so that can be one of the things that happens when we don't have our hip extension. So postpartum, especially after C-section, you want to start getting that hip extension back. One of my favorite moves. There's many, many, many ways to stretch your hip flexors, all right? Or to start working on getting hip extension, is to be in a position with your leg behind your body. And I realize I can't see this that well. to mess up the video. Darn. All right. Yeah, I can't touch it because it's going to mess it up. But I can post some videos of just getting some hip flexor stretching, and you can also look on our YouTube, and you'll find safe to do postpartum hip flexor stretches that will help get you that hip extension, so your low back isn't taking up the heat. Okay, so taking all the force and making your body extend that leg, because we want that extension to come through the actual hip itself. So we want the leg to come behind the body. And what that allows to happen is when we walk or run, our glutes can then fire and squeeze and work as our legs hit the ground. So it's a force absorber for our body. It also takes the pressure off of the pelvic floor. So this is a very, very important move to start to heal the body and heal the core. So a nice hip flexor stretch could be like putting your leg on a chair and tucking your pelvis. You tuck it down, so you're opening up the front of this joint here, all right? And just keeping the core nice and tight as you do this. Pulling the crown of my head or the ponytail of my head, if I had a ponytail in, all the way up to the ceiling, elongating through here. I hold this 2 to 3 minutes. If you're having soreness, maybe you hold it 5. Now, if you're new to this recovery and your C-section scar is very fresh, so it's not fully healed at that 6 to 8 week mark, you're only doing this to the extent that you don't want to feel stretching in the scar yet. So we're being super gentle. And so maybe for you, it just looks like standing with your leg a little bit behind your body and tightening and tilting your pelvis, so you start to feel just a little stretch in the front of that hip. Okay. Now, there is going to be some effects on when you start to do that. And especially, once you're in the safe range to do intensive scar work. So after that 6 to 8 week mark, or after you've been cleared by the surgeon, once you start to do that, then with that type of stretching is also stretching the scar tissue. All right. So even if you decide, so it's stretching it from the bottom. Okay. So, because that's how the fascia in the scars, they'll pull a little bit down, right? So then you can also add an arm to increase the stretch on the C-section scar up higher. And that might feel good. You might add a side bend, and that might feel good. Again, opening up the scar more. But for any fascial changes, there's some really strict myofascial people that will say you have to hold this for 7 minutes, 5 to 7 minutes, in order to create change. And so you're going to have to find what's good for your body. We tend to, at the clinic, suggest 2 to 4 minutes. Of course, if you can hit 7 minutes in a stretch, that's great, and it feels good. That can be really releasing and healing of a lot of that scar tissue and fascial tissue. But the reality is, a lot of people, especially postpartum, don't have the time to sit there and do a 7 minute stretch. So if you can just get a 2 minute stretch in and really start to open up your hip that way, that's excellent and a great starting point. So we talked about breathing. All right. Talked about getting that hip extension. So doing hip flexor stretching. All right. The next thing I'm going to talk about is, let's go into starting to coordinate. No, let's talk scar. Let's go right to the scar. And then I'll jump to what it's like to start coordinating these muscles. But the reality is it's really hard to coordinate these muscles. And it's hard to coordinate your core muscles if you have scar tissue within those muscles. And so, especially after a C-section, you have to get that scar tissue worked out. So we're going to talk about working out that scar tissue and really working with a pelvic expert PT, someone who understands the scar anatomy and how to get to every single layer of the scar and even the scar on the uterus, to get those moving and dynamic enough so the core can really work the way it's supposed to for you. All right. So let's pretend. So here's my sweatshirt. All right. Let's pretend this is my scar. You can pretend any one of these lines is my scar. But what is happening here is, so when I have that scar, we talked about yesterday and a little bit today that if I have a scar, it's going to be probably rolled up and pulled and tightened. So it's going to pull everything together and from many different angles. All right. So imagine that's what this scar is doing. All right. Then So we're going to work this line as the scar. A healthy scar would be able to be moved up. All right, I should just pick up that scar and it can move any direction I want. And an unhealthy scar would be that if you picked up the scar, it would fold. It would fold like this in the middle. All right, so that would mean like the scar tissue is just stuck down there. This is at least on the superficial level of the scar. But now, so we know what we want the scar to do, right? We want it to be able to like pick up and be mobile and not fold in. All right, so in order to get there, now I'm going to say this, let's not have you do this unless you've been guided by your doctor to do so, okay? Especially if you're under 6 weeks, you don't want to be manipulating the scar tissue. Now, your scar might also be super, super duper tender for you and you're not ready to touch it, or when you touch it, it feels just triggering and you're not ready to do that. That's okay. And that's really where you like work with a pelvic expert PT. They can ease you into moving the scar around. They can work different areas of the body that can affect the scar so they don't have to touch the actual area if you don't want it to be touched. But if you are comfortable touching it, or you want to get yourself comfortable touching it, you can start by just taking a tissue and touching the scar with the tissue. All right, this is called desensitization. So we desensitize the scar. All right, so we have a scar and we're just touching it with the tissue. And if a tissue feels okay, then do a paper towel, a little bit rougher. And then you can do a washcloth. And you can change the amount of pressure you give while touching the scar. Then you can work on doing circles on the scar just with the tissue. You're not changing the tissue yet. You're just like telling your brain, hey, this is safe to start working. Don't freak out, brain. Don't freak out, body. This is what needs to happen. We need to get the scar moving. We need to touch the scar in order to do so. All right, so we're just desensitizing it. Okay, so once we get to a point where it's safe to, like, our bodies are like, yes, okay, continue, please help me. This feels actually good. Or I know this is going to feel good in my future body. Then you can start taking your hand and making that connection and just touching that scar, feeling the scar. And then here's my scar line, right? So we're going to teach that scar to go up and down and side and to side and away from the body. All right, so those are the directions we want the scar to move. This is the superficial scar. I'm not talking about the deeper layers yet. The deeper layers all need to do the same thing that superficial layer is doing. But sometimes it's harder to work our own deep layers, and that's just like, again, you need a pelvic expert PT to really either talk you through this, because every scar is going to be different and everybody's anatomy is a little different. We all have different levels of adipose tissue there. We might have different levels of diastasis, which is abdominal separating. We might have our scars are going to be in different areas on the body. Our C-section scars, the doctors will get to it in different ways. And so these are just really important things to keep in mind. You're watching a very general video about how to start healing your C-section scar, but you need to work with an expert in order to truly get that healing process. This is just here for informational purposes. So, and I'm telling you how we start to progress people healing their own scars in our clinic that here in Edmonds, Washington is where we're located. Okay, so we did the tissue. Then we started with our hand, just touching the scar. Then we could do some circular movements around the scar. You can also do circular movements above the scar if you're not ready to touch the scar, under the scar, and on the side of the scar, and on the side of the scar. All right, so my imaginary scar. All right, then you can start just squeezing it if that feels okay. Now, again, 6 to 8 weeks or it's not closed, you don't do this. But if you're past that, or even if you're 5 years or 10 years, you do this. You want your scars to start moving for you. The minute you get these more mobile, you are all of a sudden, it's going to be automatic in the fact that you will feel your core being that much stronger for you. It is amazing how quickly you can recruit these muscles and start training these muscles to work for you instead of being so hindered by the scar tissue. Okay, so we're squeezing that, working that, pulling it away. All right, I can hold above the scar and just like lift the scar up, hold it for a bit, and I can do that all. So there's the scar. I can do it all along that scar line. Okay, worked out perfect that I wore a striped sweatshirt today. And then I can come underneath that scar and do the same thing. So just like pull down the scar. pull down the scar, and I'm working underneath the scar. I can go above the scar and start to pull down towards the scar line, okay? And then I can do the same thing below the scar and then pull up towards my head, okay? So you can work these different directions. Then you can start to work across the scar and pull your tissue this way. You can go back and forth, side to side, okay? We can do that with the scar. And these are all just like great moves to start to get that tissue moving, all right? So like I said, it's almost nearly impossible to retrain our core if we have dense scar tissue that doesn't move, because we need, if a scar is in this muscle, that needs to contract and relax. If a scar is there, we're going to be hindered in our ability to fully contract and then fully relax. All right, so I just want to make that clear. Get that scar moving, see someone who really can get that scar moving for you. And then at that point, then you're going to start to retrain your core. Only once you get to that point. And now I shouldn't say only, you're going to do this concurrently, but it's super duper important to get the scar moving, else your core is just for the rest of your life not going to be as effective for you. And you're going to run the risk of hurting your joints and hurting your back and all that good stuff. And like really what we see in the clinic is that we see women that are 10, 15 years, 20 years postpartum, like I discussed yesterday, and they've actually never used their core since they've had kids. And so that's what we want to avoid, right? We want to get this core moving. And I should actually say, like, even if they've had an abdominal surgery before you had kids, a lot of times people don't recruit and get their core coming back to them in the way they should. And so they go through even their entire pregnancies without using their cores, all right? And that can make delivery hard, as you can imagine. So we're talking about really any abdominal surgery. But let's talk postpartum. Go back to our C-section. We get that scar moving, okay? So we breathe to get that scar moving from the inside. We get our organs moving back to normal. Then we break up the scar tissue and get all that moving. And then we're going to start to retrain our core. So what does this look like? And now this is regardless of C-section or vaginal delivery, but we're talking about it in the realm of C-section today. So here we are, and we are going to get that C-section, or we're going to get that core starting to retrain. All right. The very first thing we're going to do when we're talking about retraining is we're going to start to recruit our transverse abdominis muscle. You may have heard of this muscle before. It sits behind our six-pack ab muscle. So it's a deep muscle that's not very visible. It's going to connect from hip bone to hip bone right here. When you engage this muscle, you're going to feel a firming under your fingers, and you should not feel like a bulging out. Like it should feel like nice and firming. You should feel like you're maybe kind of like lifting your belly button or lifting from your pubic bone, so which is down here, okay? So we're lifting from our belly button or lifting from our pubic bone. Again, I'm talking into two cameras, so it's always funny to which one I'm looking at. But so that's the move. Now, when we contract there, you shouldn't be able to see anywhere else in my body contracting. So one common thing is to, when you start contracting there, so if I was going to go just down, show you my transverse abdominis here. All right. And I firm it in. That's what it looks like. So I have adipose tissue here, but underneath that, you can see it's a really small movement, a small elevation. Now, what can also happen is you can squeeze your butt in order to get that movement, all right? Now, we don't want that to happen. So when we start squeezing our butt, we also are squeezing our pelvic floor. We want to be able to isolate this muscle, at least initially. Muscle isolations in natural life don't actually happen, right? So like if we pick up our kids, we have a whole lot of things going on recruiting-wise. If we're working out at the gym, there's a lot of muscles that are working dynamically. And that's what needs to happen. But in order to start healing from the C-section, we want to isolate and contract this. So, be able to isolate the contraction of the transverse abdominis, okay? So once we start isolating and contracting that transverse abdominis, there's a couple things we also have to think of. So you do not want to be contracting your glutes or squeezing your butt when you are contracting here. You don't want to be squeezing or contracting your inner thighs when we're here. And you also don't want to be squeezing your pelvic floor. So that would be like feeling like your anus is closing or your vagina is closing. We don't want that to happen. We want these to stay nice and open. And the only isolation that is occurring is within that transverse abdominis muscle, so that lower ab muscle. Okay, so those are just a couple things that you want to start training. And from there, then you can start working. There's a whole lot of things, but I would say from that transverse abdominis development and that core isolation, then we can work on our spinal stability. So the ability of our body to stay super still and tight as we start to train our other muscles. Okay. So again, I'm not talking specifically about what's happening in the pelvic floor yet. And I'm doing that because for a very important reason. For the most part, after C-sections, most people's pelvic floors are really tightened. And that's gonna make things worse because it increases the pressure in the entire core. And so we absolutely don't want to be contracting the pelvic floor. We don't want to be doing Kegels, regardless of whether you had a C-section or a vaginal delivery. At least not yet, or at least not until you have that control from your transverse abdominis. Because we don't want to be like squeezing everything all the time. And so that's why it's really important, like start getting this isolation from the muscle that was cut open. And then from there, you can build on every single muscle. But those are the three things. I'm going to kind of leave it at that because we could go into a lot more depth, but it becomes so much more specific per person based on where your organs are lying. So if someone was to do an internal pelvic floor exam for you, they would see, okay, your bladder is here, your urethra is here, and your rectum is here. All right, so this means that like if you continue this way, some of these organs might look a little lower. And so we have to make sure that we can help the pelvic floor relax enough so those organs can go back into their places. But if you're just squeezing and contracting your pelvic floor, or you're bearing down, and when you brace your belly, then that can push things further down the line and create more of a pelvic organ prolapse, or make these organs kind of come out of your body if they're not lifting and elevating and relaxing also. And so it just becomes a little bit more specific per your body. And that's why working with a pelvic expert is incredibly important and essential. But I think I feel confident. Really, that's all the basics I gave today are what we give our patients generally in the clinic. There's some more visceral techniques that you can do on yourself. So getting your organs moving, like we were discussing, and maybe I'll share some of those in another episode. But whether, again, you're 6 weeks postpartum or 6 years postpartum, you want to be able to do these things to your core in order to get your core working more effectively for you. And so the first things we talked about today, breathing, touching your scar, getting your scar desensitized, moving your scar, and then starting to retrain your transverse abdominis muscle. We also talked about getting your hip extension back, because that's essential for building your butt back and taking pressure off the pelvic floor and taking pressure off your back. And as you saw from my demonstrations, I'm still healing postpartum. And so here we are. This is just life, right? So thank you for joining me today. You can catch the replay on our YouTube or Instagram. And we'll be in touch soon. Take care, guys.